Good evening, everyone. Welcome to our LAM-CAA assessment. We are now on week 6 for our basic anatomy and physiology module. So tonight we're going to talk about the respiratory system and comprehensive discussion of the front view points and the Hui-Meeting points. Let's call on Ma'am Ami Glorioso. Good evening.
Good evening, Doc. Good evening, classmate.
Okay, let's get right down to our questions. Number 5 is pointing to what?
Epiglottis.
Which number indicates the vocal fold?
Number 6.
Number 3 is pointing to
Nasal vestibule.
which number indicates the oral cavity?
Number 4.
Number 7 is pointing to
Thyroid cartilage.
which number indicates the superior lobe of the lung?
Number 8.
Number 11 is pointing to
Horizontal fissure.
which number indicates the middle lobe of the lung?
Number 12.
Number 9 is pointing to
Right secondary bronchus.
which number indicates the right primary bronchus?
Number 10.
Number 13 is pointing to
Inferior lobe of the lung.
which number indicates a bronchiole?
Number 14.
Number 1 is
The frontal sinus.
which number indicates the nasal cavity?
Number 2.
Number 15 is
Pleura.
true or false? The intercostal muscles are the main muscles of respiration.
False.
So how do you make this true?
The main muscles of respiratory is the diaphragm.
Number 18 is pointing to
Uvula.
uvula. Number 26
is left secondary bronchus.
the oropharynx is indicated by
Number 19.
which number indicates the oblique fissure?
Number 27.
Number 16 is pointing to
Sphenoid sinus.
the nasopharynx.
Sphenoid sinus.
Okay, the nasopharynx
Number
is
17.
number 20 is
Number 7. Larynx.
larynx. Okay, the cricoid cartilage.
Larynx.
The cricoid cartilage is indicated.
Number 21.
Okay. Number 24 is
Number 20. Carina.
the apex is indicated by number
23.
Number 28 is pointing to
Diaphragm.
true or false? The major function of the respiratory system is gas exchange between the external environment and the circulatory system.
True.
Number 22 is pointing to
Trachea.
trachea. Sige, ganito. Trachea. Okay.
Trachea.
Which number indicates the left primary bronchus?
Number 25.
The thyroid cartilage is indicated by number.
Number 7.
Number 8 is pointing to.
Superior lobe of the lung.
Now, the nasal vestibule is indicated by number.
Number 3.
Number 4 is pointing to.
Oral cavity.
The epiglottis is indicated by number.
Number 5.
Number 6 is pointing to.
Vocal fold.
The frontal sinus is.
Pointing to number 1.
Number 2 is pointing to.
Nasal cavity.
The right secondary bronchus is indicated by number.
Number 9.
Number 10 is pointing to.
Right primary bronchus.
Inferior lobe is indicated by number.
Number 13.
Number 14 is pointing to.
Bronchiole.
The horizontal fissure is indicated by number.
11.
Number 12 is pointing to.
Middle of the lung.
The pleura are indicated by number.
15.
Wow, perfect score, Ma'am Ami. Congratulations. Very, very
Thank you,
good
Doc.
job.
Okay, thank you po.
Proud na proud po ako.
Okay, thank you po.
Salamat po. Keep up
Thank
the
you po.
work. Let's now call on Ma'am Angel ko. So bawal dito magkamali ah. Okay.
Good evening, Doc. Good evening, Pastor.
Normal resting respiration is
Is 10 to 18 breaths per minute.
gas exchange in the lungs takes place in
The alveoli.
which number indicates the uvula?
Number 18 po.
Number 19 is pointing to
The oropharynx.
which number indicates the sphenoid sinus?
Number 16.
Number 17 is pointing to
The nasopharynx.
which number indicates the larynx?
Number 20.
With number 21 is pointing to
The cricoid cartilage.
number 27 is pointing to
The oblique fissure.
diaphragm is indicated by number.
28.
Which number indicates the trachea?
Number 22 po.
Number 23 is pointing to
The apex.
the carina is indicated by number.
24.
Number 25 is pointing to
The left primary bronchus.
the left secondary bronchus is indicated by number.
Number 26 po.
How thick are the walls of the alveoli?
1 cell po, Doc.
What gas is a waste product of respiration?
Carbon dioxide.
How is waste carbon dioxide expelled from the body?
Through expiration.
Which substance is another byproduct of cellular respiration?
Water po.
What is the correct branching order into the lungs?
Trachea, bronchi, bronchioles.
Bronchioles. Ano yung
Bronchioles.
po ng bronchiole? What is the main purpose of respiration?
To sustain life.
What are cilia?
Cilia is hair-like projections on the cell surface.
What is the singular form of cilia? Cilium.
Cilium. Okay, noted
Okay.
po.
What is anaerobic respiration?
Respiration without oxygen.
What are alveoli?
Air sacs in the lungs.
What substance builds up in muscle during anaerobic exercise?
Lactic acid.
Which of this is a substrate for cellular respiration?
Glucose po.
What is the most abundant gas in the atmosphere?
Nitrogen po.
What are the muscles between the ribs called?
The intercostal muscles.
Okay, this is very easy kasi costal is ribs, no? Okay.
Yes po.
Why is the alveolar surface moist?
To aid the diffusion of gases in the alveoli.
Which gas is crucial to all the body cells?
Is oxygen po, Doc.
Which of these are accessory respiratory muscles?
The external intercostal muscle.
Contraction of the diaphragm causes which action to take place?
Inspiration po.
Which compound in the blood carries oxygen around the body?
Hemoglobin.
The scalene muscles are accessory muscles to which action?
Inspiration po.
What type of condition is asthma?
Obstructive condition.
Which structures ensure that the trachea is kept open?
Cartilaginous rings.
What is the function of the cilia in the trachea?
To waft foreign particles up the windpipe.
What causes hiccups?
A spasm in the diaphragm.
What function does the mucus in the trachea serve?
To trap foreign particles.
Why is the trachea made of incomplete rings of cartilage?
To allow food to move down the esophagus.
What is the function of the epiglottis?
To prevent food going down the trachea.
Which of these are accessory muscles to inspiration?
The sternocleidomastoids.
After full inspiration, the forced vital capacity is a measure of
The volume of air forcibly blown out.
What does the pressure in the lungs do during expiration?
It increases.
What causes an oxygen debt in the body?
Anaerobic exercise.
Congratulations po, Ma'am
Thank
Angel.
you po. Thank you po,
Ano ba
Doc.
ginamit nyo yung references natin?
Yes po, Doc. Thank you po.
Okay, congratulations. Maraming salamat. Keep up the good work. Let's now call on Ma'am Lynn Galarita for pathology.
Yes, Doc.
Which of the following is a protective reflex that clears the breathing passages of fluids and foreign particles?
Coughing,
In respiratory disorders, the letter COPD stands for
chronic obstructive pulmonary disease,
recurrent episodes of wheezing, shortness of breath, chest tightness, and unproductive coughing characterize which of the following conditions?
asthma,
A blockage of an artery in the lungs by a substance that has traveled from elsewhere in the body through the bloodstream is called
pulmonary embolism,
emphysema is an older term for
COPD,
what percentage of cases of lung cancer are due to long-term tobacco smoking?
85%,
Which of the following is an inflammatory condition resulting in a cough, difficulty breathing, rapid breathing, and a fever?
pneumonia,
Failure of the left ventricle of the heart to remove blood adequately from the pulmonary circulation results in the condition called
pulmonary edema,
which of the following is an infectious disease caused by a bacterium which is spread through the air?
tuberculosis,
A chest cold is an acute form of
bronchitis,
an inflammation of the membranes that surround the lungs and line the chest cavity is called.
pleurisy,
Which of the following techniques involves insertion of an instrument into the airways to examine for abnormalities?
bronchoscopy,
Hiccups are due to involuntary contraction of which of the following muscles?
the diaphragm,
Inflammation of the voice box causing symptoms that might include a hoarse voice, a cough, pain, and trouble swallowing is called.
laryngitis,
Croup is a type of respiratory infection common in children which causes swelling.
in the trachea,
Tobacco smoking is the most common cause of which of the following?
COPD,
Asthma is thought to be caused by
genetic and environmental factors,
sputum production, shortness of breath, and productive cough are the most common signs of
COPD,
a malignant lung tumor characterized by uncontrolled cell growth in tissues of the lung is called.
lung cancer,
Which of the following is an inflammatory condition of the lung affecting primarily the microscopic air sacs known as alveoli?
pleurisy,
Which of the following is a crucial cardinal feature of congestive heart failure?
pulmonary edema,
Sudden shortness of breath, chest pain when breathing in, and coughing up blood are possible symptoms of.
a pulmonary embolism,
What percentage of latent tuberculosis infections progress to the active form of the disease?
10%,
An inflammation of the bronchi, the large and medium-sized airways in the lungs, is called.
bronchitis,
In more than 90% of cases, acute bronchitis is caused by.
a viral infection,
Which of the following is a disease in which there is permanent enlargement of parts of the airways of the lungs?
bronchiectasis,
An abnormal collection of air in the pleural space, which causes an uncoupling of the lung from the chest wall, is referred to as.
a pneumothorax,
Synchronous diaphragmatic flutter, or SDF, is the medical term for.
hiccups,
Okay, so we should start calling hiccup as SDF.
social,
An inflammation of the bronchioles, the smallest air passages of the lungs, is known as.
bronchiolitis,
Which of the following is a respiratory condition that most often occurs in children aged between 3 and 6 months, involving inflammation of the bronchi?
bronchiolitis din po,
What is a thrombus?
a blood clot,
When the leaflets of the valves in a vein, for example, in the leg, no longer meet properly, allowing blood to flow backwards, the vein is referred to as.
varicose,
Leukemia is a group of cancers that usually begin in the.
bone marrow,
Cardiac arrhythmias are due to problems with.
The heart's electrical conduction system.
Thrombocytopenia is a blood disorder in which there is a relative nakamute po yata kayo. Are you okay, Ma'am Lynn? Decrease of
Ay, nawawala signal. Okay na po. Sige po. Number 6 po, Doc.
number 5.
Anong number? Number 5, decrease of thrombocytes.
Okay. A heartbeat that is below 60 beats per minute is called
Bradycardia.
a decrease in red blood cell production can lead to which of the following?
Anemia.
A blockage in blood flow is called
An infarction.
above which of the following blood pressure readings would most adults be considered to have high blood pressure?
140 over 90 millimeter mercury.
Angina is caused by
A reduced blood flow to the heart.
which of the following is a common cause of high blood pressure?
Atherosclerosis.
Hypotension is considered as a diagnosis if the systolic blood pressure is less than
90 millimeter mercury.
which of the following is a normal resting heart rate for most adults?
60 to 100 beats per minute.
What is the medical term for the small dilated blood vessels, commonly known as spider veins, which can sometimes be seen near the surface of the skin on the face, leg, or at the ankle?
Telangiectasis, ectasias.
Yes.
Hirap bigyan.
One,
Telangiectasias. Okay.
yes. One common definition of thrombocytopenia that requires emergency treatment is a platelet count below
50,000 per microliter.
Were all this found in the references?
Ni-research din po namin sa Google yung iba, Doc.
Okay. Sige. Congratulations, Ma'am Lynn. Na-maintain natin yung ating pagka-perfect. Congratulations. Keep up the good work. Thank you po. Now, let's call on Ma'am Mary Jan Ledesma. Good evening po.
Good evening, everyone. Belated happy birthday, Doc. Yes,
Thank
ako
you very
tama ba?
much. Thank you.
Sana tama, sana all perfect. So, I'll try. I'll do.
Okay, low blood oxygen is called
Hypoxia.
a casualty suffering from mild hypoxia will have
Difficult thinking. Difficult thinking clearly.
how long without oxygen does it take for brain cells to start dying?
3 minutes. Tama po ba? 3 minutes?
3 minutes.
Hello?
Yes, 3 minutes. Ano yung maingay?
Hello, Doc?
Hindi pala maingay.
Ay, may, sorry.
Okay. Yes. Okay, 3 minutes. Signs of hypoxia,
Yes, for 3 minutes.
gray-blue tint to the lips,
Then,
noisy breathing, a red puffy face, and signs of hypoxia. Hello po.
hello po. Number 3 na po tayo.
We are already in number
Wait, slow breathing. Number 4 na po ba? Slow breathing, Doc.
Are you sure?
Hello?
Okay, ganito po.
Wait lang. Nasa na. I'll try. I think chest pain.
No.
No. The number average is stand dry
Ano ba
cough.
to? Did you check our references?
No, Doc. Actually, naghanap pa ako sa iba kasi
Ah.
medyo nag-research din sa Google.
Hindi nyo na-research doon sa binigay namin info?
Nag-try din po ako, Doc. Kaya lang parang ang dami medyo confused. Ganun. So, ni-research po sa Google. Tapos medyo hello?
Yeah, anong answer nyo dito?
Actually po, ang first choice ko is slow breathing.
Was that found in Google?
Wala, inisip ko yan. Actually, inisip ko lang yan, yung first
Ano ba
choice
nangyayari
ko.
sa hypoxia? Una, what is hypoxia?
Nawawalan ng hangin. I think nawawalan ng hangin.
From the term alone, like hypoxia.
Ay, teka,
Kulang sa oxygen, di ba?
kulang sa oxygen.
Okay. Mabagal ba yung paghinga mo pag kulang ka ng oxygen? Okay, so inisip ko lang po. Okay, sino pong makasagot nito? Who gave another answer? Can I call on Ma'am Lane Arandia? Ma'am Lane Arandia? What is your answer here?
Ang sagot ko po, Doc, persistent dry cough.
Okay, did you check our sources?
No po. Inisip ko lang yun.
Inisip mo
Sinula.
na. Okay. Persistent dry cough. Alam mo bakit? Kasi 'di ba, hindi nagde-descend yung lung chi. Kulang kasi sa oxygen, 'di ba? Pag hindi nagde-descend yung lung chi, umaakyat ulit. Ayun. Okay, did you get that, Ma'am Mary Jen? Thank you, Ma'am
Okay.
Lee. Ma'am Lee.
Thank
Okay po.
Okay. Huwag nyo lang isipin. You have to really think.
Okay,
Number
Doc.
5, a hanging casualty should be handled carefully because they might.
Have a broken neck.
A drowning casualty who has recovered quickly should still go to a hospital because the water may have irritated the lungs and the air
I think
passages.
I have a broken neck.
You have a broken. Okay, nasa number
Becomes
6 na po tayo. What's your
Ano
answer
ulit?
for number 6?
I think, becomes swollen an hour later.
Okay. When the air passages swell hours after a drowning incident, this is called what?
Secondary drowning.
Okay. The symptoms of prolonged exposure to low levels of carbon monoxide are headache, confusion, nausea, and
Lethargy. No. Tama ba? Lethargy. Tama ba?
aggression.
Lethargy. Yes.
A lung may collapse if air enters
The pleural space. Pleural.
pleural space. The collapsed lung is called
Wait lang. How do you pronounce it?
pneumothorax.
Peneo. Okay.
Pneumothorax. Okay. A pneumothorax could be caused by
Drowning?
no.
Oh, ay, sorry. Ano yan? Sabi lang kanina. Wait lang. Chest wound.
Chest wound. When dealing with a penetrative wound in the chest, you need to
Cover the wounds and maintain breathing.
acute anxiety and panic attack can cause what?
Hyperventilation.
Someone suffering an asthma attack difficulty breathing have
A long breathing and out of breath.
outphase. What color is the cup of the inhalers used to relieve an asthma attack?
Brown cup.
I'm sorry.
Brown cup.
Nakakita na ba kayo ng inhaler?
Hindi pa.
So saan nyo nakuha yung brown cup?
Ano po to? Na-research ko lang yung iba. Kaya nang madalian.
Okay. The answer is, what is your answer, Sir Darwin?
Blue.
Blue cup. Were you present last week, Ma'am Mary Jen?
Actually, yes, Doc. Ano
Okay.
lang.
Do the question sound familiar?
Okay.
Okay.
1 minute.
A treated mild asthma attack should ease within
First choice ko, sir, Doc, 1 minute.
ano po ito? Inulaan nyo lang or ni-research nyo?
Yung iba, sir, Doc, hinulaan ko lang. Yung iba ni-research ko.
So, yung hinulaan nyo, sigurado kayo tama. Ito, hindi po man na-research. Take note, treated mild asthma attack. Kailan siya dapat mag-relieve?
Okay, sir, Doc. 3 minutes.
3 minutes. Group is caused by inflammation of the
Weep 5 and larynx.
larynx.
Larynx. Weep 5.
Mag-a-attend po ba kayo ng praktiko? Kung makita nyo nasaan yung back. Okay. You have
Yes
to
po.
An obstruction of the airway can be caused by a foreign object or by
Internal swallowing.
casualty of trunk will have
Prominent, teka lang. Basahin ko. Prominent veins on the face.
if dealing with strangulation or hanging, it is important to keep the material that was constricting the neck as
Keep the casualty warm. Asan naman ako? I think the doctor will want to see it. And the police.
alin dito the best answer? Lalo na pag
The
ikaw,
doctor will...
siyempre tatago mo
Sir, the doctor. Kasi I have to see.
dito. Bakit itatago yung will be kasi ang ano ng doctor is to resuscitate.
In have to see. Parang ganun.
So sino po ang magbe-benefit?
The police.
Okay, the police. When dealing with a casualty of drowning, it is important to control breathing and
Keep the casualty warm.
carbon monoxide stops red blood cells from
Getting the oxygen to the body tissue.
some of the effects of coughing and breathing, rapid and noisy breathing, and
Kulap lungs. Kulap lungs.
naninigarilyo, nag-smoke, collapse. Ito yung pinaka-common collapse lang. Pag nagkaroon ka ng tingin mo, inhale ko ng smoke, ano yung pinaka-logical dito na? Isip. This was already taken up last week, diba? So we presume na medyo maaratan natin. So what is your answer?
Okay, sir. Next choice ko. Burning in the mouth, in the nose.
Okay. Promptly, red blood being pumped up may be a sign of
Penetrate wounds to the lungs.
during a severe asthma attack, a person may
Become exhausted.
group is an attack of severe difficulty that affects.
Very young children.
In order to stop a group attack from recurring after one that has just happened, you need to.
Hello.
What's your answer here?
Create the atmosphere.
Create a humid atmosphere. Epiglottitis is when the epiglottis is infected and can
Block the airway completely.
during an asthma attack, you will need to call the emergency services if the casualty worsens, or if the relief inhaler, one is available, has had no effect after.
I think 5 minutes.
Yes. Wag mo pa I think na.
Okay lang. Sa work ko, dilim kasi dito.
Okay. Before entering a garage full of exhaust fumes, you must.
Let the gas escape.
Okay. Now let's go to front point. Saan po ang location ng ating
Okay. Ako ulit. At the chest and abdomen.
Okay, what is the meaning of front?
It's to gather, collect, or recruit.
Yeah, dito po nakakolect lahat ng chi ng organ. Okay? Front points are used for treating what? The organ or the channel?
Organ, sir.
Very good. Okay. What is the front main point of the lung?
Lung 1.
Good. Front main point of the lung is
Spleen 25.
Okay.
ST20.
Yeah, stomach 25. Front main point of the spleen.
Liver 13.
Front main point of the stomach.
Ren 12.
Good. Front main point of the heart.
Ren 14.
Front main point of the small intestine.
Ren 4.
Front main point of the kidney.
GB 24.
24? No? Yan ang sinabi ng reference mo.
Yes, Doc. Dahil ko
Can
mali.
you show us your reference?
Ano po, Doc? Yung sa books at saka ni-research ko yung iba kasi hindi siya lahat nasa book na reference.
Okay. What does it say?
Take note ko na lang, Doc, ang mali ko, Doc. Sorry.
Eh, sinabi mo GB 24.
Yes. Yes. Nakalagay po dito sa notes ko, 24.
Really?
Baka mali nga. Ako.
Ano closer? Baka naman may problema yung ano mo.
Baka Doc, ako may problema. Hindi, take note ko na lang. Kung mali, pwede naman i-correct.
Okay, let's call on. Who has another answer? Let me. Ma'am SP. Ma'am SP de la Cruz, good evening po. Ano po ang front point ng kidney? Ma'am SP, are you there? Hello po. Okay, let's call on Ma'am Joy. Joy from Baguio. Ma'am Joy, what is the front main point of the kidney?
Hi, Doc.
Yes, hi.
Front move, Doc, of the bladder.
No, kidney. The one on the screen right now.
Wait, Doc, that's a... Wait lang po.
Kidney. Front. No.
Sabi ni Ma'am Mary Jen, the front main point of the kidney is GB 24. Do you agree?
GB 24 of the kidney, Doc.
No, ang tanong ko, would you agree na ang front main point of the kidney is GB 24?
20, di po ba 25, Doc?
Okay, kasi nakakahiya ang doktor. Yan ang natutunan nyo. Ma'am, mukhang kailangan mo na siguro ng salamin. I hope you don't get offended, Ma'am Mary Jen. Okay?
May salamin na po ako, Doc.
Makakailangan
Pero,
mo ipa-change yan.
okay. Okay, take note 25.
Okay, so when you
55.
attend the training, I think it's a 2-day practical with Dr. Webb, you have to make sure you already know where those points are. No? Okay. Front main point of the bladder. Thank you, Ma'am Jen. Please redeem yourself, Ma'am Mary Jen. The bladder.
Continue po at Ren 3. Bladder is Ren 3.
Okay, how do you locate REN 3? tell us how many tunes from the navel? Down or up?
Oh, again, Doc.
Okay, tell us the location of CV3.
Hindi ko alam.
O, ano ba yan? Kailangan alam niyo po yan. Okay? Papanidal
Sige, Doc.
help out. Okay, let me call on. Oh, Sir Michael. Where is Rent 3? Sir Michael, are you there? Okay. Ano ba yan? Okay, can we ask Sir Victor Ginto? Nasaan po ang Rent 3? The front view of the bladder. How do you locate
Rentry ba, Doc?
Opo, ilang tunes from the navel, going up or going down?
Going down the navel. Hindi
Ilang-
ako hindi po ako nagkakamali, mga 4 siguro, 4, 5, di ko kabisado to.
Ba't di kayo pwede magkamali? Bawal magkamali. Ganito ha, hindi po ito puro lang memorization. Ano yung point? You have to know how to locate it. You have to be sure, Sir Victor. But anyway, thanks for trying. Oh, let's call. Okay lang po yun. Hindi po ako galit. Okay, let's call on Dr. Sam. Where is Rent 3? Dr. Sam?
Hello, Doc. Yes, good evening. Rentry actually is located 4th tune below the navel.
Okay. Did you get that, Sir Victor? Are you now sure?
Yes po, tiningnan ko rin yung yung atlas. Tama po, fortune.
Okay. Saan nakalocate si anong tawag mo doon na 1.5 tune from the navel down?
Ren 7.
1.5 tune below the umbilicus.
1-6.
1.5.
Fingers. Ano po yun? Importante yun. Ren
1-6.
Ren 6.
Ren.
What about tune from the navel down? What do you call that boy?
Ren.
Okay. So Victor, bawal na yung kung di kayo nagkakamali. You have to be sure. Okay?
Okay po, Doc.
So, ano lang po ito? Boodle time.
Okay, Doc.
Actually, fortune. Okay. So now we know that, yeah, yon. Okay. Papunta na tayo doon. Sige po. Maraming salamat, Sir Victor. I hope you don't get offended. Ano lang po to ha? Especially,
po.
we're actually preparing you for your revalida. We're thinking if we could do it online. We'll
Yes
divide
po,
you
Doc.
into groups.
Actually, natusok ko na rin po yan, pero nakalimutan ko.
Oh, pero sure na kayo nun eh. Hindi lang kayo sure, di ba? If I'm not mistaken, do not give that kind of answer, okay?
Okay. Okay po. Sorry po,
Never
Doc.
teach that to your ano. So, kaya tinawagan ko si Dr. Sam, kinonfirm niya na tama ka. But you were not very sure. But it's okay. At least, but never say, if I'm not, kung hindi ako nagkakamali, it's fortune. You have to be sure. Okay. Thank you po,
Correct.
Mr. Victor.
Thank you
Now
so
let's
much.
call back on Ma'am. Are you still there, Ma'am Mary Jan?
Yes, Doc. I'm ready, Doc.
Front view of
And
the pericardium.
pericardium, wait lang. Run 17.
So how do you locate REN 17 on a male?
Run 17. Unfortunately, hindi ko siya
No,
chinek, Doc.
unfortunately. Okay. Magtatawag na ako ngayon. Uy, magtutusok-tusok kayo sa ano ha, sa practicum. That's the reason why you have practicum. Okay? Okay, do not just memorize, front view of the pericardium REN 17. Where is it? How do you locate it? Okay? So,
Yes, Doc. Thank you. I'll
excuse
take
me now. Yeah, I hope you don't take this too seriously. This should somehow
I'm happy.
encourage you to read more. Okay? I will now call on, let me see. Okay, tawagan ko si Sir Michael. Sir Michael, asan po ang Michael Rivera? Sir Michael, are you there? Pag hindi ka na-assign, you have to be more on your toes. Okay? Naku, wala na. Mukhang inisnab tayo. Okay. Oh, Ma'am Darlene Federico. Good evening, Ma'am Darlene. Would you like to tell us where Ren 17 is located? Ma'am Darlene? Uy, nawala sila. Ano ba yan?
Yes,
Okay.
Doc.
Okay, yes, Ma'am Darlene.
Good
Where
evening
is Ren
po.
17?
Around 17 is located at the level with the fourth intercostal space
Yes.
midway between the nipples.
Okay. Oo, so yun yung gusto ko malaman. At the level of the fourth intercostal. So during your practicum on March 15, 14, 15, okay, you have to locate that. Okay? Sa lalaki, it's easy. But for women, you need to really know where you have to really locate the intercostal space, the fourth intercostal space. Okay? Thank you very much, Ma'am Darlene. Okay, let's continue, Ma'am Mary Jen. What's the front view
Yes,
point of the Sanjiao?
Sanjiao Ren 5.
Okay, tell us the location, please.
Liver, Ren 5, Doc.
Ilang tsun? Below the umbilicus. If Ren 6 is located,
Wait.
1.5 tsun, nasaan si Ren 5? Ilang tsun below? Nakuha. Okay. Let me call again. Naku, huwag niyo lang i-memorize yung ano ha. You need, when we say front move, you have to know where it is located. And this is the reason why you should have practicum. Okay? So let's call on... Okay, tanungin natin si Ma'am Angel. Ma'am Angel, where is Ren 5?
Hello, Doc.
Yes. Can you tell us the
Okay.
location of Ren 5?
Ren 5, number 13. So,
Ren
Ren
5 for
5 is
exception
location on the middle of the abdomen, tukon below the umbilicus.
Okay, 2 tsun.
Opo,
Okay, sino yung si 1.5 tsun is Ren 6. So kung si Ren 5 is 2 tsun below the umbilicus, nasaan si Ren 4?
3.
Okay, 3. Nasaan si Ren 3?
4 tune.
Okay, thank you. Front view of the liver. Thank you po. Thank you, Ma'am Angel. Okay, let's go back to Mary Jan. Front view of the liver.
Liver 14.
Front view of the spleen.
Spleen. Wait, spleen? I think, well, wala akong spleen dito. Gallbladder na yung sunod.
Anyone? Where's the front view of the spleen?
Liver 13.
Okay.
Liver 13.
So, if liver 13 is the front view of the spleen, liver 14 is the front view of the liver. Okay, Ma'am Mary Jen, last question. How many points does the liver channel have?
Liver channel. Ilan? Ano po yun daw? How many? Wala dito.
Ilang points meron ang liver meridian or liver channel?
Liver siya.
Naku,
Two?
ilan?
Wala
Ilan?
yun.
Who would like to answer? Tulungan nyo.
40.
14 po.
Okay, very good. Front view of the gallbladder. Ma'am Mary Jan, this is your last question.
Yes, GB24 ang sagot ko, pero sabi ka, yeah, GB24.
So, kung si GB24 is the front view of the gallbladder, kaninong front view si GB25? Di ba kanina lang yan? Ano ba yan?
Front view ng kidney.
Ulitin ko, if gallbladder 24 is the front view of the gallbladder, kaninong front view si GB25? Or is it really a front view? Or whatever?
Yeah, front move of kidney.
Yes,
Tama
kidney.
ba?
You're done. Thank you very much, my Mary Jen. Okay, how long do you answer? You have to
Enjoy
start
it. Very
answering
excited.
tonight, yung for the gastrointestinal.
Yes, though I take note everything na mali. At saka yung inyong advices. So,
Okay, thank you.
I really enjoy it.
This is for your own good. So make sure that when you attend the practicum, you already know the locations. Okay? That's the reason why when we have practicum. Thank you very much. Now let's go to Baguio. Ma'am Janine, are you ready?
Yes, Doc.
Okay, how many front view points are there?
6.
Okay. 6?
Okay, Doc.
Name them?
Lung 1, liver 13, stomach 12, GB 24, pericardium 17. Tama ba, Doc?
Yun lang? Parang ang konti naman. Do you agree? Okay, who has another answer? Let's call your kababayan. Ma'am Joy.
Ay, isa pa. Kulang pa ako isa.
Hindi Ilang
12,
points?
12.
Lahat po sila, Dok, lahat ng points, di ba, nasa close proximity.
Yeah. Located on the chest or abdomen, in close proximity to their respective zang or fu. 12.
Yung 12, Dok, di ba?
The 12. Okay.
6, ang konti naman lang 6.
Oo
So
nga,
there are
Doc.
12 front view points. Go. Okay. All front view points lie on the anterior of the body, except what point? Which lies at the free end of the 12th rib. Of course, we're referring to a front view here.
Gallbladder. GB 25, Doc?
Very good. Yeah. You should be very sure of your answer. So, kaninong front view point si gallbladder 25?
Kidney.
Kaninong front view point si GB 24?
Si gallbladder.
Kaninong front view point si liver 13?
Hindi ko na alam, Doc.
Ay, kailan naman yung ano ba to? Instant memory.
Hindi nga, Doc. Hindi ko kaya, Doc.
Okay, liver 14. Kaninong front view point si liver 14?
Liver.
Liver 13.
Spleen.
Kanina lang yan, di ba? Hindi po pwedeng instant delete. Bawal yan. Okay. Continue. Don't be discouraged. Of the 12 points, only 3 lie on the channel corresponding to their related zang or fu. So what are they?
Lung 9, GB 24, and liver 14.
No, wait lang. I'm talking about front view. Lung 9 is not a front view point.
Mali na naman yung aking nabasa, Doc. Sorry.
No. It's like this. Do you understand the question? Ibig sabihin, they don't actually lie on the channel. For example, Hindi pala. Kasi kung sasabihin ko, alam niyo na yung
The 12 point only rely on the, wala Doc, talagang medyo I'm kinda not great at this yet. So, aminado
That's
naman
why
ako.
we have this. Okay, so you have to take this down. Okay, sige. It's okay. Thank you for being honest, but you're not off the hook yet. Let's ask. Asan na ba si Michael? Sir Michael, where are you? Yung mga hindi tinatawag, yun ang taga.
Hello po. Hello po,
Okay,
Doc.
Michael, do we have 3 front view points?
May answer po.
Channel talaga nila.
My answer for this question, Doc, is lung 1,
Okay.
liver
that's
14, and gallbladder 24.
Wow. Okay. Can you say it again? So ibig sabihin, lung 1 is nasa lung channel niya. Did you
Opo.
know this? Liver 14 is nasa liver. Okay. How many points meron ang lung channel, Sir Sir Michael?
Hindi ko na-research, Doc.
11.
11. Ilang points meron ang gallbladder 24?
Ilang points?
Gallbladder 24. Sorry. Ilang points ang meron ang gallbladder channel? Sorry. Oh my God, kakahiya. Ilang
Sorry. 2 points yun, Doc. Divitor 24 bilateral.
Oo.
That's true.
My question is, how many points meron ang gallbladder channel?
44.
Yeah, 44. You're correct. You should know these things. You should know these things. It's so important, especially when we do the ear, when we locate the meridians on the ear. Okay. So did you get that, Mom Janine? Can you mention?
I repeat again, Doc. Lung 1, liver 14, and gallbladder 24.
Okay. So come practicum, you have to locate where that is. You have to know, you have to learn how to needle it, especially lung 1. Okay? GB24, liver 14. Napaka-importante. Okay. Let's go back. Thank you, Sir Michael. Let's go back to Mom Janine. Of the remaining 9, so di ba 12 minus 3, the 3, they lie on their channel being a front view point. So saan naglalay po yung remaining 6? Yung 6. So 6 of the 9.
Conception vessel,
Very good. Or the red mine.
the Renman.
Okay. The term mu, this is a repetition, no? The term mu means to gather or to collect, and the front view points are where the chi of the Zhangfu does what?
That's what I don't get, Doc. I didn't answer that.
Actually, we have answered this earlier now.
Okay.
This is where the chi of the Zhangfu gathers and concentrates on the anterior surface of the body. Okay? Front mu, we usually being the front of, di ba last time we discussed the bakshu. Bakshu nasa likod, young, but it's very good for treating chronic issues. Samantala yung front is good for treating acute conditions, no? So most practitioners, they would combine both. So ibig sabihin, you should know the bakshu and the front mu. Okay? Yeah. Okay, so I hope we're good.
Pero Doc, uunahin mo yung back shoe bago yung front mo?
Depende sa'yo. Kung nakikita mo mas komportable. Ako kasi habang chinichigaw ko, iniuna ko yung back shoe. Tapos, dapat yan 10 minutes lang eh. 15. Yung iba naman, tinitape yung kaya lang mas safe kasi pag hindi mo ititape. O, diba? Like, and I presume you already know how to needle the back shoe. And I think that will be explained that will be demonstrated by Dr. Webb come practicum. Okay? So let's proceed. The classic of difficulty says the blank of the 5 zang are located at the yin aspect, that means the front, while the blank points are located at the yang region.
No answer, Doc. Even 22. Sorry. Wala, I skipped
mo.
these 3.
Okay, who
Nasa
would like to
23
answer
na
this?
ako.
Sinong gusto mag-try? Go.
I can answer, Doc.
Sure, sige,
Can I
go.
try?
Yes.
The classic difficult says the mu of the 5 song are located at the yin aspect, while the su point are located at the yang region.
Very good. Okay.
Ang ano ko po, ang aking source po ay Deadman.
Oh, di ba? Binasa niya yung Deadman, pinaprint pa niya. Okay. So I hope everybody will not rely lang on Google lang, ha?
Opo.
Yes. Okay.
Dito po.
Now, thank you very much, Sir Michael. I hope we hope to hear more from you again. Number 22, Ma'am Janine.
Oh,
Fill
I
in
didn't
the
answer that
blanks.
also. Hindi ko rin sinagot yan, Doc, eh. 23 na yung sinagot ko, Doc.
Oh, sige. Sir Michael, please come to the rescue.
Yes, the classic of difficult says yin diseases travel through the yang.
Yes, the yang region.
And
And
the
yang
yang
diseases travel through the...
yin region.
Okay. So the mu points
Now,
situated in the yin region, they may be used to treat...
yang diseases.
Okay. The shu
Yeah, and the
points...
su point are situated in the yang region. They may be used to treat yin diseases.
Okay. Can you give us an example of a yin disease? Which is yin? Pag sinabi mo bang yin, ano ba yon? Acute or chronic?
Chronic po, Doc.
Ang galing. Wow. Pag acute,
Ito po yung mga...
Okay, very good. Okay, sige. Ang galing. Wow. Okay, so I hope you learned from Sir Michael, Ma'am Janine.
Yes,
Okay,
Doc.
so now you have an
Sir
answer
Michael.
for number 23. What's your answer here?
What are the 2 major aspects of both? This is where the chi energy of the Zhang Fu gathers and concentrates on the anterior surface of the body.
Okay.
More, Doc.
Okay. What's your number?
They are associated with specific organs and used for treatment of related organ issues.
Okay, ganito ha. Number 1. Okay, why do we need to know the back shu and the front mu? The major aspect. One major aspect is they are likely to become tender. Kaya dapat lahat po kayo may probe. Okay? Now, kung nakita mo, medyo kalbo na siya, tapos masakit yung likod niya, tapos medyo maedad na. So, you might want to look at, especially kung meron siyang flank pains, no? Tsaka medyo matakaw sa maaalat. You might want to probe or ipe-press mo po yung, okay, ano palang ipe-press natin? Okay. So, sabihin na natin, nabibingi, tapos masakit yung likod, low back pain, knee pain, and kalbo, ano pa? And then mahilig sa maaalat, katulad ng ibang kakilala ko dyan. Okay, so ano sa palagay nyo ang ini-needle mo? Like, so you would be considering, okay, let's talk about the front move. Sabihin na natin, napaka-recent lang, no? So what's the front move of the kidney again?
Should be 25.
Yes. So you should know the location. Now, you just don't develop that kung meron kang predisposition to it. Considering the age, let's say past 60, plus 50 na siya, past 50 or past 60. So you might want to consider, kasi yung ano niya, matagal na siguro yung low back pain niya or yung knee pain. So you will have to consider looking at the iano mo yung likod din, which is bladder 23, right? And the next one is, they are commonly combined in treatment, which I usually do. Okay? So for example, we combine bladder 28. Bladder 28 is the backshoe of what?
Bladder.
Yes. So if bladder 28 is the backshoe of the bladder, sino po ang front mo ng bladder?
Rentry.
Very good. Wow, nakakataba ng puso. And I know you all answered the same. You all gave the same answer. Thank you so much. Did you get that, Ma'am Janine?
I'm listening, Doc. Yes.
Yes. So we expect Dr. Sang to be to mentor his very good students in Baguio, no? Alam niyo dyan sa Baguio, because the weather there is cold, especially makinig kayo sa Saturday. It's going to be a very short presentation. We're going to have hopefully a very interactive discussion on how we approach people with low back pain. Okay? Hope you can make it at 5 o'clock on Saturday. It's going to be, we'll try to discuss. Kasi for us, like when you talk about low back pain, you need to consider saan siya nakatira, you have to consider the age, you have to consider like ilang taon na siya nagwo-work, all these things. Yung sex life niya, yung mga ganon. Okay? Okay, what about this, Ma'am Janine? Can you answer this, please? How many front view points lie on the REN channel?
6
Very
points.
good. And, ayun lang pala. Okay, thank you very much, Ma'am Janine. I hope we were able to, did you have fun at the most recent practicum with Dr. Webb?
Yes, Doc. Very much.
Great. So now, sa totoo lang, no, anatomy and physiology will definitely help us locate the points better and at the same time, make us assess the patient more clinically, no? And this is so important, okay? So thank you so much, Ma'am Janine.
Thank
Now
you,
let's
Doc.
proceed to, okay, from CDO, our dentist, Dr. Templo, Dr. Mary Angeli, are you ready? I hope you are. I'm sure. Dr.
Yes,
Mary.
Doc.
Yeah, very good. Okay. Ang pronunciation po nito is Hui. Dinouble check ko na po to, ha? So Hui or meeting points. Okay.
Hui. Yes, po.
So what are Hui meeting points? Can you tell us po, Doktora?
Hui meeting points are influential points or gathering points po.
Okay, so these are the other names. So what do you exactly mean by... Okay, what does it... influential. Ibig sabihin, may impact po siya, no? So that means they affect a certain type of tissue, di ba? Or substance throughout the body. So these points, do not ignore them because they are so important. Okay? They are very important. So other names, I hope everybody got that. Hui or meeting points are also known as gathering points. They're also known as influential points.
Influential points.
Yeah, they affect a certain type of tissue and also or a substance throughout the body. And they are very used frequently in the clinic. Kaya ito dapat ang iniisip natin, especially if your patient comes in with a bone problem, no? So, yon. Doctora, what is the Hui meeting point of the pulse and vessels?
Lung line.
Very good. Okay, what's the Hui meeting point of the chi?
It's REN 17.
Wow, nahiya naman ako. Alam na alam. Okay. It is called also known as the upper C of chi. Okay, it has a strong effect po sa ating zong chi. So nasa taas banda. Okay, gathering or zong.
Center of the chest.
Yeah, very good. Now let's go to number 4, the Hui meeting point of the fu or the hollow organs, the young organs. Yeah.
It's REN 12 po.
Okay. So REN 12 is also the front view of what?
Front view of stomach.
Very good.
Stomach po.
But in reality, okay, ako naman, to be honest, since usually patients come to us because they have issues with their Fu, no, with their young organs. So never forget the REN12. So yun. Kasi nasa center si stomach. Number 5, Doctora. What's the Hui-Meeting point of the Zhang? Or the solid
Liver
organ?
13.
Okay.
Liver 13.
Yeah, very good. Liver 13. So liver 13 is also the front move of?
Spleen.
Okay.
Spleen.
Now you know. So ganito lang po yan. Si spleen and stomach lang po talaga. No, they're the center. They're called the earth, right? So spleen, liver 13. So it is the influential point of the Zhang, of the solid organs. Wala ako. Okay, the stomach, the Fu, the stomach, REN12, is the influential point or the Hui point of the Fu. Okay. Number 6, what's the Hui meeting point of the bone indicated for various bone diseases?
UB11 po.
Very good, Doctora. So I understand you will be coming for. We really appreciate that, Doctora. Alam ko as a dentist, you already have a background sa ano, but again, the main emphasis here is the location of the points, and
Yes po, exactly.
Dr. Webb can actually help us out. In fact, you wanted it for 2 days to help you really get a full grasp of the needling. So, ang bottom line po talaga noon is needling. And I tell you, after you have mastered all these points, nako, alam nyo na kung bakit. Okay. And
Hopefully po.
yes, no? So this is not all about anatomy, no? Nakakatulong talaga po. Okay, number 7. Ay, bakit ito naulit?
The
Okay. Same question.
Yeah.
Medyo natulog
Same
yata
question.
ako nito. Okay, sorry po. The Hui meeting point of the blood.
It's UB17.
Okay, UB17 or bladder 17. We usually use this for any issue. Okay, blood deficiency, blood stagnation, ano pa ba? Yeah, anything involving the blood. And
Any blood
this is
disorders.
what you do. When you look at the tongue, pag medyo purple na po yung tongue niya, that is a sign of blood stagnation. And you would always also look at the sublingual veins, no? Napaka-importante. And at the same time, you need to feel the pulse. So we would be also looking at choppy ba siya, or is it wiry, yung mga ganon. Okay?
Okay po.
And the next one, the Hui meeting point of the sinews, the main point to influence. Yeah.
It's GB34.
Very good, Doctora. Okay, so hopefully you will learn how to needle gallbladder 34. Okay?
Okay po.
Thank you po. And the last one, Hui meeting point of the marrow.
GB39 po.
Okay. I presume you would know how to locate this. Okay.
Practice.
Yeah, so I don't know if it was Ma'am Lynn, sinabi niya effective daw po talaga ito for people with bone issue, with marrow issues. So when you talk about the marrow, we'll be talking about the gene, no? Yung ano. Anyway, for now, I want you all to be familiar with all these points. Okay? Thank you so much, Doctora. It's an honor to.
Thank you, Doc.
Hopefully we can see you in Manila very soon. Thank you very much po.
Yes, Doc.
Thank
Thank
you
you.
po. Now let's go to Sir Darwin. Sir Darwin, kanina pa ready. Okay. Okay, how many influential points or Hui meeting points are there?
8 po, Doc.
Galing. What are the 8?
Liver 13 for Sang, for Fu, Ren 12, for Chi, Ren 17, for blood, bladder 17, for the sinews, GB34, for the vessels, Lung 9, for the bone, bladder 11, and for marrow, GB39.
Okay. I hope you can put that all in your head. And I tell you, it will really pay off. Okay? 8 lang naman yan eh. And this is the one that will really create a big impact sa pasyente. Okay? Especially for those who are fond of press needles, as long as hindi nababasa, you might want Pionex press needle. Okay, so you might want to use it. Nakakatulong talaga. And this will really make the patient feel na you really care for them because you teach them. Thank you very much. What Hui-Meeting point affects, ay, naku, ulit na naman. Okay, all the yin organs.
Liver 13.
Great. What is liver 13?
It's the meeting of the yin organs.
What else?
Front view of the spleen.
Okay, yun. What is the function of liver 13?
Liver 13.
Di ba inulit-ulit lang natin?
Promotes flow of liver chi. Quickens blood, transports blood.
Okay.
Transports blood. Yeah.
It tonifies the spleen. Di ba siya yung front view ng spleen? It tonifies the spleen and the Zhang organs, right? Make sense? Okay. What happens if the spleen becomes weak? Yung napakalaking issue. Ano ba yung nangyayari pag humina yung spleen natin? I know you are still batch 2, but as early as now, we want you to... By the way, those who are batch 1, right after we finish, no? Meron tayong 1-week break. Pa naman kaawaan tayo ng June. Holy Week po ang last week of March. And so we will resume April 1 for our 10th, no? And then after that, we will immediately proceed to maghihiwalay na po ang batch 1 sa batch 2. Batch 2 will continue with treatment principles, while batch 1 will proceed to TCM foundations. This is where we discuss the yin and yang. Ganito rin din po ang format because I find this very effective, no? So every Wednesday, tuloy pa rin yung ano ng batch 1. We'll have the assessment, and that will be your last module. And after that, you will be having your clinics already, and we expect you to have more patients or more and pa-process na natin yung nyo po sa clinic. And then batch 2, we will proceed to TCM. Magmi-meet tayo for assessment every Thursday po. Thursday or Friday, whatever, whichever day you would feel more comfortable. No? So I think Thursday na lang kasi most of you would go out for the weekend. Okay. So let's continue. Ayun na po, tonifies the spleen. Okay, my question was, what happens if the spleen is weak?
Pwedeng may dampness.
Dampness, very good. So dampness, okay, by the way, ano ba ang function ng spleen? What is the main function of the spleen?
Transformation at saka transportation
Very good.
ng food.
So we will explain that in another module. Wow, I'm so proud of all of you. So you can see the impact of liver 13. Huwag niyo pong kalimutan yan. You should know how to locate it because you do not only tonify the spleen, but you tonify the Zhang organs. And I presume you already know what are the solid organs. Okay, what Hui-Meeting point affects the yang organs? You've taken this up?
CV12.
Okay, CV12 or REN12. The Fu, no? The Fu, the hollow organs. What is REN12?
The Hui-Meeting point of food.
And the front
view of the stomach.
Okay, so this is the star, the star point for all the solid organs, no? No, I'm sorry, the yang organs, the Fu. So it's actually the stomach. So kung ang REN12 is stomach, yung ano naman is spleen, yung liver 13.
Liver 13.
Remember that. So what does REN12 do?
It's the important point for transformation distribution, the essence of food.
So it basically fortifies the spleen as well. Remember, the stomach and spleen, they work together, no? It also tonifies the stomach. Okay, paano po ba yung chi flow ng stomach? Going up, going down?
Going down.
Going down.
What about the spleen?
Up.
Stomach is down, going up. Like, where does it go? Bakit siya nag-up? Kasi pupunta siya sa lungs. Are you batch 2, Sir Darwin?
Ay, hindi pa.
Batch 1? Parang batch 1.
Ay, batch 2 pa, batch 2 po. Batch 2.
Okay, so let's start the Rivalida now. So the stomach and the spleen. Okay. What will make the stomach not work? Okay, what happens if the stomach chi is affected? Di ba sinabi nyo kanina, normal stomach chi flow is downward. So ibig sabihin, when it goes the opposite route, like tinatawag nating rebellious, so that means the stomach is weak, right? Kaya we would need REN12 to tonify it. So when you say tonify, we strengthen the chi flow. Ipapababa siya. So my question is, what causes that? Or what conditions will, like, talking about stomach and spleen, so we're talking about pagkain. So how are you going to prepare your stomach? And we all know that the stomach serves as the receptacle for the food. And it is the spleen that will transform whatever it is in the stomach into what? Food chi.
Food chi.
Right. Okay. Then food chi or ku chi, ito pupunta sa lungs, right? And you know what happens there. But anyway, dito muna tayo. My question is, how are you going to, like, syempre, aside from acupuncture, what would you advise the stomach, the patient to eat? Like, how do you prepare the stomach? Or ano ba ayaw ng stomach? Yeah.
Stomach hates dryness.
Yeah. So how are you going to prepare your stomach? You should drink something warm, right?
No.
Or you should eat soup. You don't drink the soup kasi mainit. So you should have warm soup. No, you eat. Okay? But what do most of us do? We drink cold water. Ayaw ng stomach yan. Okay? What else? So you were saying ayaw niya, ayaw niya ng dryness. Ayaw din niya ng malamig. Okay? Now let's go to the spleen. Remember, the stomach and the spleen, they work together. Ang spleen naman, since it transforms and transports, what prevents it from doing so? Like, would it be healthy to be eating while watching TV? Would it be healthy to be eating while you're in front of the computer answering your emails?
No.
Okay, how will I strengthen my spleen? Kasi you mentioned kanina, if the spleen is weak, you will have dampness, and dampness can have a huge impact, right? That's why we need to use those points. So my question is, what are you going to advise the patient to do? Like, meron siyang spleen issue. Will you advise him to drink water, cold water, or warm water? Will you advise him to be drinking water every time you put something in your mouth? Okay, there are many things that one has to do, especially when we discuss the gastrointestinal next week. Dapat minamasticate, chinuchew natin yung pagkain. Kasi may mga enzymes dyan. But most of us, hindi nang inunguya. Ginagawang pantulak yung tubig. No? Yes? Do you agree? Yung iba dyan, guilty dyan. Yung iba, wala pang 5 minutes, tapos na kong kumain. And then busy pa mag-answer ng mga, social media nila, no? Nakatutok sa cellphone. And they prefer cold drinks, right? Yeah, especially parties. Of course, they serve soft drinks, cold. Hindi naman masarap pag hindi cold yung soft. And what do you feel right after? Of course, you tend to eat a lot. You eat fast, and sometimes you don't chew your food at all because you are afraid that you might run out of, baka hindi mo makain yung gusto mong kainin. And so we down it with water, cold, right? Cold soft drinks. So after that, you feel bloated. And then after 30 minutes, nandun pa rin yung craving mo kasi you're hungry, kasi walang nangyari. Okay? You feel lousy, you feel bloated. Okay, so that's it. Thank you so much. Number 19, what Hui-Meeting point affects the qi?
10-17.
Very
10-17.
good. Matagal mo sinagot. Para kang stress. Okay. What is REN 17?
The way meeting point of chi.
And the upper C of qi.
Upper C of chi.
Okay, what does it do?
Regulates chi.
I'm sorry?
It regulates chi po.
Yeah. It actually affects your zong qi, your gathering qi. Diba? So, I presume you know what is God. Pero sige lang. Alam nyo na yan. And also, ano ba yung organs na nagre-rely sa gathering qi? What two organs would rely on the zong qi or gathering qi? Can you mention that too?
The lung and heart.
Very good. So the lung controls respiration and the speech, while the heart controls the blood and blood vessels, right? Now you know. Thank you very much, Sir Darwin. Good job. Very good job. So alam ko talaga pag seryoso. And finally, we call on Sir Elvis Blones. Good evening, Sir Elvis.
Good evening, Doc.
Okay, you will be the last one for today. What Hui-Meeting point affects the blood?
UB17, Doc.
Okay, I want you to master the technique of locating bladder 17. Okay? Sa totoong tao. Alam nyo, ang dami pong may blood issue. Ha? Blood stagnation, kung maputla naman yung dila, that's blood deficiency. Okay? Kung may blood deficiency ka, meron ka rin qi deficiency, meron ka rin qi stagnation. Ganun lang yun. What is bladder 17, Sir Elvis?
Blood influential point, Doc.
Anong bakshu siya? Bakshu of what?
Bakshu. Blood reserve. Wala, Doc.
Hindi meron na.
Blood.
No, hindi.
Blood influential point.
What's the major muscle of inspiration?
Diaphragm.
Diaphragm. Ay, ano ba yan? Okay, bladder 17. Actually, ito mga points na didiscuss natin, paulit-ulit, these are the most important. You have to believe me. Okay? So, in fact, I consider this to be the most important point for blood disorders. Okay? And it is called the diaphragm bakshu. Siyempre, pag may problema sa circulation, hirap ka rin huminga, di ba? Heart and blood. Okay, what does bladder 17 do? Sir Elvis.
Useful for all blood-related conditions, Doc.
Can you mention the blood patterns? I mentioned two kanina.
Blood
Blood
stagnation.
stasis or blood stagnation. Blood deficiency pag chronic. Pag acute. Anong pattern?
Heat in the blood, Doc.
Yeah, wow. Ang galing naman. Heat in the blood. Wow, ang galing-galing nyo. Wow. So ngayon, alam nyo na, pag acute, no? Heat in the blood or blood heat. Pag deficient, pag chronic, blood deficiency. Blood stasis is excess. Okay, what Hui-Meeting point affects the sinews?
GB34, Doc.
Okay, so alam mo na, what is GB34?
Yes, Doc. Influential point of sinews.
Okay, anong part ng body are considered to be the residence of the sinews?
Lateral part, Doc.
No, what particular part? Di ba the heart is the residence of the shen? So sino ang residence of the sinews?
Residence of sinews. Liver, Doc.
Hindi. Residence.
No idea, Doc.
The knees. Yung tuhod natin. Di ba? Alam mo na kaagad na ano, so tusok mo na kaagad yung GB34. The knees are the residence of the sinews. At saka, it is called, if we go further, we've taken this up na pala, no? It's called the C point, the earth point of the gallbladder, GB34. Remember, the earth point. So the residents of the sinews are the knees. So always think of GB34. So anong ginagawa ni GB34? Did you read on it?
Useful for treating soft tissue anywhere in the body, Doc.
Ano pa po?
Contracture, cramping, pain, spasm, weakness, numbness, paralysis, sciatica, and issues with the low back, hip or lower limbs, knees, all disorders of lateral
And
region of the
also
back.
stiffness of the neck. No, stiffness of the neck. So dito mo makikita yung value ng balance method. And Dr. Gavino is an expert on that. We will probably take that up soon para hindi kayo malito. And you will only understand the balance method if you have memorized or mastered the channel theory. No, yung okay, sa kanila. So it's good for the sinews. It dominates the sinews. Yung mga nagko-contract yung sinews. Stiff neck, maganda din siya. O, di ba itsura nung GB34 parang nandito rin sa neck? Yun, it's called good also for the shoulders. You'll be amazed. So don't forget the shoulders. The GB34. Anything that nag-move na may muscle. Diba? Okay, joints, knee, lower leg pain, hemiplegia, and also atrophy. So what Hui-Meeting point affects the vessels?
Lung 9, Doc.
What is lung 9?
Lung 9 is the influential point of the vessel.
What else? Marami po siyang classification. By this time you should memorize it.
Source point of the lung channel.
Okay, Yuan source point, yeah, of the lung, earth point, no? It's also called the shoe stream. Okay?
Yes, Doc.
Anong ginagawa ni lung 9?
Lung 9 tinipay lung chi engine for cough, asthma, wheezing, shortness of breath, chronic runny nose with watery discharge, palpitation, or wrist pain, arm pain along meridian.
Okay. Yeah, tonifies the lung. Okay, I have a question. Ano usually ang kamay ng pasyente? Of course, you would sometimes shake the hands, di ba? In fact, pag shaking pa lang ng hands, pag hawak mo lang pa sa hands, malalaman mo na kung anong imbalance meron. And you would know immediately what point to use. So my question is, ano ang magiging kamay ng pasyente pag meron siyang disharmony ng gathering chi niya and blood vessel flow? Right? Kasi kanina minention ni Sir Darwin that it's the heart and lungs, right? So it actually harmonizes your gathering chi and your blood vessel flow. My question is, so what happens if, ano yung ini-expect mo sa isang tao na nangangailangan, i-needle mo yung lung 9? Ano yung kamay niya, malamig o mainit?
Malamig, Doc.
Very good. So ibig sabihin, after the treatment, you should expect na ang kamay niya uminit. Okay?
Yes, Doc.
And sige, and you need to know, okay, actually we've given you a lot of references. So we expect you, so I'm very happy because Sir Michael loves Deadman a lot. Okay? Maganda po siyang reference. And do not just stick to one, no? Para paulit-ulit, you know. And it's a very good feeling pag sinabi ng, ay, uminit na yung kamay. And also, we just don't look at lang 9. This is the reason why we also study the back shu and the front mu, right? Okay. What Hui-Meeting point affects the bone?
UB11, Doc.
What is UB11?
Influential point of the bone.
It is also called the point of sea of blood. No? Actually, sige na, wag na muna. We have a lecture on YouTube, yung points of the 4 C's. So dapat alam mo ano yung 4 na dagat, no? One of which is the sea of blood. So the point of the sea of blood is bladder 11. Okay, what is bladder 11 indicated for?
For bone problems such as osteoporosis, arthritis, inflammation, sensation of heat in the bones.
Okay. So I would presume na alam nyo pa paano i-locate po ito. Okay? Next,
Yes,
I think this is the last one. What Hui-Meeting point affects the marrow?
Gallbladder 39, Doc.
So what is gallbladder 39?
Influential point of the bone marrow. Sea of marrow.
Yeah. Ano ba yung sea of marrow? The brain.
Yes, Doc.
Weird, no? It's called the brain. Doon napunta sa GB39. The source of bone marrow. And the last one, anong ginagawa ni GB39? What are the indications?
Excess and deficiency condition affecting the bone marrow, ligaments, tendons, muscles, and or bones.
Okay.
Like pain, spasm, numbness, weakness, chronic B and Hui syndrome, especially with kidney deficiency.
Yeah, you're correct. But kailangan nyo po ito gawin, yung mga ayaw magka-stroke. Okay? GB39 prevents strokes. So, try to locate GB39. You do it on yourself. Kasi the worst thing that can happen to us is, di ba, ang pangit naman ma-stroke tayo dahil sa pagod.
Ano yan, Doc? Normal needling, even needling, or tonify, or sedation?
You can actually use, kasi gusto natin i-tonify no? So pwede mong, depende kung masyado kung ang stroke mo is due to dampness, kasi karamihan sa atin yung mga pagkain hindi masyadong, masarap masyado. Diba? So would think of dampness. And karamihan, meron ng rheumatoid arthritis. No? So maganda yung GB39. Okay? And according to our source, it's really good for preventing strokes. So you can even do moxa here, GB39. Okay? And para sa kasi yung mga may edad na rin, lalo na pag may RA, you might actually want to use stomach 36 and GB39 to prevent strokes. Do not forget stomach 36. Okay? So malapit lang po yan sa ankle joint, yung GB39. Huwag niyo pong isnabin. It's so good, no? Let's take a look at one of the sources. It actually, so nasa 3 tunes siya above the tip of the lateral malleolus, okay? Between the posterior border of the fibula and the tendons of the peroneus longus and brevis. So you have to review your muscular system. So ngayon, kilala nyo na sa peroneus longus and brevis. And use GB39. Okay? So that's it. I thought we would finish in 1 hour, but again, I'd like to thank everyone for joining. I hope you had fun. Do you have any questions before we go?
Yes, Doc.
Yes, Sir Victor. Yeah.
Yung sa GB39, kasi nakaka-prevent ng stroke. Paano po kung na-stroke na, may use ba siya?
Wala nang ipiprevent. Wala nang ipiprevent. That's the time na you need to use other points. So,
So hindi na siya gagamitin pag na-stroke na.
pwede pa rin gamitin pero do not expect recovery. Marami tayong modalities for stroke. Kaya yung mga pupunta ng Manila, find time to really, paano ba? Paano ko ba sabihin? Okay, kaibigan niyo si he's here, si iPhone 12. That's Dr. Gavino. He's an expert on scalp acupuncture. My experience with stroke, mas mabilis. Kasi pag na-stroke, syempre una-una mong goal is pagalawin. 'Di ba? And at the moment we have like 10 ano. So, ewan ko lang kasi practicum eh. Sana mag-coincide. You might want to visit Manila from time to time. Sa Philippine Academy of Acupuncture Inc., we are actually scheduling a lecture series on scalp, no? And it's very exciting because there are 3 modalities of scalp acupuncture na ituturo. One is the WHO technique. The second is meron tayong Jiao, which is my favorite kasi it's easy to learn. And the third one is the INSA, Yamamoto scalp acupuncture, Yamamoto new scalp, whatever, INSA, YNSA, which is an expertise in Dr. Gavino, no? What I like about scalp is it's very scientific. This can actually foster your relationship with the neurologist. Yung kasi mas ano po siya, mas direct. Kasi pag na-stroke na, ang goal natin is paano siya pagalawin. Especially pag hindi pa umabot ng 1 year or 6 months nga eh. No? So, minsan 1 year, 2 years na, ang tagal. Kaya if you're interested, we would like to invite you to visit the webpage of Philippine Academy, PAI, no? Or you can ask from Sir Albert how to. I'm actually the education department head of PAI, no? So, marami po silang lecturers doon. And even if hindi pa kayo certified, you are welcome to join as a non-member. So, we're actually working for the inclusion of those who are really serious. Marami po kasi talaga matutulungan with scalp acupuncture, no? Or you can visit our YouTube channel. Meron po tayong 10. Sa totoo lang, 1 or 2 lang yata ang medyo favorite ko doon, no? Ang maganda po siya, especially when you do electroacupuncture. So yung mga pupunta ng Manila from the provinces, make sure na ma-maximize nyo yung pagpunta nyo and try to get in touch with a lot of, mababait po sila. Or you visit the PAI office in the Pitak building. Okay, kaya yung mga mag-iis pupunta doon, lalo na from the provinces, I suggest that you stay for like 2 or 3 days. You can stay at Lamp, kung wala kayong matitirhan. Cowboy naman yata kayo, no? And try to expand your, Kaya ang tinuturo namin is yung needling. Okay? We can help a lot of people. Okay? So, yung mga stroke, ang concern talaga natin is paano siya mapalakad, no? Dahan-dahan. Ang pinakamaganda ang response is yung wala pang 6 months. Pero most of the people who come to us, yung dumaan na sa PT, sa ibang mga ano. So, dito papasok ngayon yung modalities natin. So, we're very happy that you are all interested. Don't worry, kung hindi kayo makaka-attend ng scalp acupuncture, we still have other, we're actually scheduling also in LAMP after the one in PAI is nabatapos na. Okay? So, did that answer your question, Sir Victor?
Yes, Doc. Maraming salamat po.
If you don't mind, di ba, ano po kayo, no? Di ba dati naka-cane kayo?
Yes po. Yes po, Doc.
So, you're very, congratulations. Dinonate nyo daw yung walking cane nyo sa, sa lamp. Gusto nyo bang
Opo.
bawiin? Kasi kung
Hindi.
binawin nyo yun, hindi naman kayo nakakalakad ulit. Okay.
Roller skates na po.
So, ganun po, ma-maximize nyo, magpaturo na kayo mag-needle, the technique. It's very, very important. And I tell you, pag marunong na kayo mag-needle, then everything will be easy. So all you have to focus on are the theoretical aspect of acupuncture. Kasi iba po talaga if you know what you're doing, no? And we hope that our system will work for all of us. And whatever comments or complaints you have with regards to our, we are very open. We are willing, we are very open-minded. We're willing to listen to your concerns, no? So maraming salamat po, Sir Victor. Are you enjoying life so far?
Yes, Doc. Kasi nakakalakad na nga po.
Oo nga no? Diyos ko, you have a lot to thank the Lord for. So share nyo din. Alam nyo, one way of is to make ourselves productive, no? I'm sure not all of you are, hindi nyo ginagawa ito because you wanted to be so successful, but you want to help other people. Ang pinapangarap lang natin is hindi tayo ang ma-stroke because it would be very shameful kung nag-acupuncture ka tapos na stroke ka. Diba? Kaya dapat medyo ingat-ingatan natin. Like emotions. Emotions can really impact your organ, believe it or not. Sa Western medicine, hiwalay ang mind sa body. But in Chinese, we connect it. And I tell you, pag yung iniisip mo yung problema mo everyday, meron kang kinikim-kim na galit, sooner or later, mai-stroke ka rin. Pili ka lang, stroke or cancer.
Doc,
So,
may question po ako. Dun
sure.
sa GB39 to that it prevents stroke. Can we can we can we do it every day just to make sure na hindi tayo ma-stroke today?
Ay, naman. Twice a week. Twice a week.
Twice a week.
Or you can do
Okay po.
moxa. Moxa mo. Iano mo
Yung
muna,
moxa po pwedeng every day.
Yes. Stomach 36 and GB39. Na una-una, iano mo muna kung tender siya or i-needle mo kung yun.
Okay, Doc. So, parang, na siya, maintenance, ganon, na twice na.
Moxa, maraming moxa na bebenta. But okay naman sa Baguio kasi 'di ba malamig. Ewan ko lang, hindi masyadong lumalabas. Yung pinaka-effective na moxa, yung mabaho. Pero syempre, kung enclosed yung space mo, yung smokeless. Pero hindi daw siya ganun. Pero at least effective na din.
Effective.
So yon. And prevention talaga importante. Kaya tanungin nyo si Sir Victor how he was able to walk again. And it's a blessing. And then don't promise your patient, no? Hindi naman tayo siguro, no? Not all of us can. It all depends on una-una you have to make sure that the patient likes you. Hindi ka parang medyo negative yung dating. And kasi if the patient likes you, he will trust you. No?
Yes, Doc.
Ganun
Doc,
lang.
may prevention po ba for heart attack?
Yes, of course. Una-una, you have to understand what causes a heart attack or myocardial infarction. So, I believe we have already taken that. Diba? Sino ba yung sumagot kanina about infarction? May, may nagbara. Hindi maganda yung flow. So, you have to make sure na hindi barado yung flow mo. Anong prevention? Acupuncture twice a month. With or without symptoms. Kaya ang problema kasi sa mga tao ngayon, pupunta lang pag may problema. So this will, I'm sure there are PTs here na mas nakakatulong sa kanilang career. No? Especially if, ang dami mo ng pasyente and people will know na masyado kang well-rounded. Yun. So how often? I would suggest twice a month or every week if you have the month, if you can, kung marunong ka naman. And your basis would be your tongue. Look at the sublingual veins. Make sure na hindi siya masyadong obvious. You barely notice them. Because if they're too obvious, you have to look at the tortuosity of the sublingual veins. At saka yung taba niya. Kasi siyempre pag payat din yung mga veins, that speaks a lot about yin deficiency or blood deficiency. Masyado namang mataba, so that's blood stagnation. So that's very excess, no? At saka tingnan mo kung nakabalot ng parang plastic yung mga sublingual veins. So that is actually phlegm or dampness. So maybe you should go slow. And what I like about looking at the sublingual veins is you can already forewarn the patient. Medyo bawas-bawasan na ang maga. It's not only the food no? Kung yung buhay mo puro negative, puro kagalit, puro ka masyado kang mahilig sa telenovela, sa mga drama. Hindi ka makamove.
Tama, Doc.
These are the things that will I might hit a raw nerve, no? Pero ang akin lang kasi, like things happen, hindi naman natin ginusto yon. So, if things did not turn out the way you wanted it, acceptance or probably forgiveness, no? Or give it another try. Kasi the moment you, what's this? You let it affect you, tingnan nyo mangyayari, una-una dyan yung liver. Alam naman natin yung liver the chi of the liver can stagnate. So what happens pag nag-stagnate yan? Okay? Umiinit. No? Pag nag-stagnate yan, affected yung stomach mo, affected yung spleen mo, affected yung lungs mo, everything. Or the worst thing that could happen is it can affect your heart. That's why we see people na masyadong matagal na yung anger na nagkaka-heart attack. So, and some people, they just fake their, because they want to hide the emotions. Hiding the emotions is very bad, no, health-wise. Kasi nga, syempre, we are civilized and we do not want to appear very uneducated by making sigaw-sigaw. Punta ka ng beach na walang tao, you shout at the top of your voice and make sure nobody is taking a video. Or basagin mo lahat ng mga platong mamahalin na collection mo. O kung nagtitipid ka, mga itlog, no? Isang tray ng itlog. Ilan bang itlog yung tray? And then, kunin mo ulit, lutuin mo. At least practical, diba? Or, umiyak ka, then move on na. Or, ay ano ba to? Puro advice na. Importante kasi, you should have peace of mind. No? Like, kung yung buhay natin puro confrontation, and you wanted to get back, like, revenge is a very negative thing, no? Yan, mga ganon. And I know it's easier said than done, no? But isipin mo na lang kung magkaka-cancer ka or mai-stroke ka. Pili ka lang sa dalawa. So,
Neither, Doc.
So first, I know it's difficult, no? But it's the mind no? If you keep on thinking about it, or if pwede pang ma-resolve yung issue, you try to talk it out. Kung ayaw na, di wala kang magagawa. You just have to accept it. And yun. Ay, ano ba yan? Ang mga tanong. Ay, hindi naman tinanong. Kasi
parang merong pinariringgan si Doc, parang real advice.
I know, I'm talking about my patients, no? There's one patient that I had. She came in with cervical masakit yung leeg niya for 1 year. Married for 15 years. Ay, ano ba to? Okay. Ang una, pinaiyak ko talaga siya. Biglang lang siya umiyak na umiyak, especially after I did the ear needling. And then, sabi niya, ano ka ba to? Parang kailangan mo talaga sabihin. That's after needling this one, no? Kalimutan ko na yun dito, pati yung GB13. Basta here, 0.5 soon below, before your anterior hairline.
Do 24.
Yeah, do 24. Thank you, Dr. Sam, for saving me. Do 24 and GB13. I tell you, nag-iiba talaga. After, I saw her after 3 days, sabi niya, Doc, nawala yung pain. Tapos nagulat daw yung husband niya, hindi na siya nagsisigaw-sigaw. Tapos, ang nangyari kasi, she wanted to do something else kasi naging housewife siya. Medyo malaki yung ng husband. So, she's expected to be a housewife. Yun pala, she wanted more. Ibig sabihin, she wanted to make her own money. Siyempre, pag si husband lang, yun yung setup nila. Sabi ko, nagtagal ka nga ng 15 years eh. So, ano gusto mo mangyari? Hiwalayan mo. Too late. Diba? Ay, wag mo nang hiwalay. So, alam mo, nagbago yung niya. She looked at the brighter side and ngayon yung husband naman niya nagmumura, bakit hindi na siya nagagalit? Sabi ko, dali mo yung husband mo, may issue yan may issue sa health, no? Oo, so stress. Yun, so ang akin lang is emotions can really impact. So Dr. Sam, would you like to share some of your cases? Kaya nga gusto ko mag-focus talaga sa emotions. And emotions can impact your organs. And when your organs are affected, everything will be chaotic. Dr. Sam?
Yes, Doc. Sorry, Doc. Medyo na busy.
Okay.
Ano po yung question, Doc?
Would you like to share? Kasi parang alam na alam niyo yung GB13 and
Yes, Doc. Actually, meron po kaming patient na isang pastora na pumunta po sa clinic. Then, through facial analysis, napapansin ko meron po siyang grief. So, parang hesitant po siya magsabi. Ang purpose niya magpa-acupuncture. So, I tried GB13 and do 24. Ayun, Doc, nagkukwento na siya.
Yeah. Okay, let me interrupt. Sometimes, hindi mo tinatanong, sasabihin na niya.
Yes, that's correct, Doc. Nagkukwento na siya, tuloy-tuloy na po.
Yeah, and always remember, there are patients, they feel better pag may nasasabihan sila.
Yeah, totoo yan, Doc. Actually, during the treatment, anong matapos, masaya po si Pastora. And then, yun nga, sabi niya, actually, nasabi ko na yan dito sa kasama ko. So, ang kasama niya ay isang, kapatid yata niya. So, naikwento niya na daw doon. At naikwento niya ulit siya, paano niyo po nalaman? Sabi ko, hindi ko nakikita kasi sa face. May truth serum po tayo eh.
So, yung mga estudyante ni Dr. Sam, no? I know that you have this amazing program. So I hope you can share your blessings to them, no? And by the way, lalong nag-i-improve. You know what? Yung nangyari sa pasyente ko, actually nagtaka na siya. Sabi niya, ay, once a week na lang tayo magkikita. Sabi niya, oh, okay, yeah. She wanted, nung nakita niya, iba talaga yung aura, no? Nag-change talaga yung aura. So you might want to teach them how to do facial gua sha, and I am very proud to tell everyone the best. I learned it from Dr. Palanca herself. Is you have to use VCO, virgin coconut oil. And the good news is not because friends kami ni Dr. Sam, so binigyan niya ako ng sample, but I found it so effective. Kasi pag gumaganda yung itsura, especially when you do gua sha at night on your own, iba talaga. no? Kaya congratulations to Dr. Sam. Marami po siyang scent and nawala yung langsa nung alam mo, di ba, VCO, parang amoy, ewan
Opo.
ko how we did it, pero nawala yung amoy.
Opo. Actually si Sir Darwin Misola, naka-prepare na po yung for shipping na po bukas kasi na-order po siya.
Yes, wow. And I'm sure word will spread, no? That also always remember na yung pang take home nyo, meron kayong mga ear pellets. Si Dr. Sam meron yan. I will get in touch with you pala, Dr. Sam, very soon, ha?
Sure, Doc.
Thank you. Okay, so any questions? Ma'am Joy, did I hit a raw nerve?
Hindi naman, Doc.
Okay. Okay, parang
Tanong para sa ibang tao yun, Doc.
Ay, okay, good. Oo. Okay, kung wala na, puno na tayo, Marites. We'd like to thank everyone for joining. I was hoping na isang oras lang tayo, pero umabot ng 2 oras. So that means you're so interested, and I'm really, really grateful and very proud of all of you na you found our program effective. Okay, basta ang goal lang talaga natin is to really master the art of, this is not about needling lang, it's about diagnosis. Tingnan niyo si Dr. Sam kanina, nagtaka yung pasyente niya, bakit mo alam na merong akong foot? No? It's so difficult to teach that. It takes practice, no? Alam mo talaga, pagpasok pa lang, even the way they walk, even the way they shake your hands, you would immediately know. Kaya I would suggest, like especially for batch 2, we will master 5 elements. That's so important, I tell you. The yin and yang, the association ng mga elements, everything. Okay? Actually, merong iba nagpa-practice na sila 5-element acupuncture. Ito yung tinatawag na constitutional acupuncture. Meron pang isang term na I forgot. Basta it's all about kasi emotion talaga, grabe ang impact niyan. Okay? So yun, paiyakin mo lang ng paiyakin or let the patient talk. Una-una is, hindi naman sila magkukwento sa'yo if they don't like you, if they don't trust you. Kaya congratulations, Dr. Sam. I hope you can share your technique. No? Yun. So with that, I hope everybody had fun. We will meet again on Wednesday next week. Try to get a copy na of your gastrointestinal. So malapit na po tayo. We will be having 10. So more than halfway na nga tayo eh. And we'll be okay. Okay, so again, I'd like to make mention that for batch 1, you only have 1 module left. That's treatment principles. I was thinking of already really grilling you with respect to, kasi this is very important, no? Patient, na tayo, assessment, cases na. And for batch 2, we will have a separate meeting for you for TCM Foundations. Okay? So with that, okay, goodbye na. Thank you so much. We hope you had fun. Good night, everyone.
Good night, Doc.
Thank you, Doc. Thank you po. Good night, everyone. Good night, Doc.
Thank you po. Good night.
Thank you po.
Bye po.
Night.
Bye po.
Bye-bye.